Welcome to the Retirement Evolved podcast with certified financial fiduciary Adam Bruno.
Welcome back to the Retirement Evolved podcast. I'm Lauren, and on this show, we focus on the mechanics of retirement, the math, the tax code, the risk management, just to help you keep that plan on track. We aren't here to talk about travel tips, or little fluff like that. We're here to really talk about protecting your principal, optimizing your cash flow, and getting you set with the best retirement ever. What we're going to focus on today, one of the largest yet most understood line items in a retirement budget is healthcare. And if you aren't looking at Medicare as a financial variable, you're missing a huge piece of the puzzle. Because we believe in a holistic approach, we often bring in outside experts to ensure our clients have the best possible specialized eyes on their plan. And joining me today is Brian Barrett. Say hi, Brian.
Hi, everyone.
Brian is an educational specialist and founder of Senior Healthcare Professionals. Brian, you spent 25 years in the public school system as a teacher and principal before moving into the retirement space. And you've said before that you didn't leave education, you just moved into a more enlightened way of helping people. So tell me about that transition.
It was unique. I went from my original teaching. I was an elementary school teacher, 5th grade. And so instead of now, I've progressed from 10-year-olds to 65-year-olds, but seems like they're still big. It seems like they're still babies, just in bigger bodies, I say.
I get that. I totally get that. That's awesome. We appreciate you, partnering with us at Evolution, just because it really just, it makes everything so cohesive here. So let's get just started with some technical stuff. At Evolution, we view healthcare as a long-term liability. And when you sit down with a client, whether, we refer to you or you have your own, how do you help them quantify the actual cost of Medicare over a 20 or 30-year retirement?
Well, the first thing I have to do is I have to do a lot of unteaching, because it seems like every single person out there, it's very confusing, and they hear a lot of opinions out there. So the first thing you have to do is you have to teach them that Medicare is not free. You have to teach them that based off of their income is how much they're going to go pay for Part B. Part A is usually free for 99% of Americans if they or their spouse have worked 40 quarters or 10 years. However, the minimum Part B this year is $202.90. That's with an individual tax return of less than $109 or a joint tax return of less than $218,000. So 95% of Americans are paying a minimum of $202.90 per month, and that adds up over the years. In addition to adding up, that number's not stagnant, it's increasing. When my parents started Medicare 20 years ago, that number was $98 per month per person.
Wow.
And in the last 8 years I've been in this industry, it's risen from $134 to $202. Last year, the number was $185 per month. So it's really increasing lately.
And that doesn't include the Part D, right?
No, that is just the Part A and B, which is your starter of Medicare. And then eventually you're going to have to go of one of two options. Option one will be a supplement with a standalone Part D plan, which you just mentioned, or the other one's an all-encompassing card called Part C Medicare Advantage Plan.
Okay, and so when you're making a choice, what are the trade-offs between original Medicare and Medigap or Medicare Advantage?
Well, they're 100% opposite plans, meaning whatever's good on Medicare with a supplement is a negative on an Advantage plan, and vice versa. Whatever's negative with a Medicare and a supplement is a positive on a Medicare Advantage plan. For example, Medicare and supplements have no networks. So that means my clients could go to any doctor or hospital in all 50 states that accept assignment of Medicare, whereas the opposite is true on Advantage plans. There are networks, which means that the clients are only allowed to go where these private health insurance plans are accepted. And it's the same, no referrals with Medicare Post Supplement, and then referrals on the private health insurance advantage plans. Premiums for supplements, no premiums for advantage plans. And I could list about 10 factors, but the point is they are 100% opposite. And what I tell everyone who I'm speaking with or consulting with is your decision needs to be based off of these factors. Number one is budget, then health history, doctors, access to doctors, specialists, medications, travel, and in genetics. And no two people are alike. So I have husbands on an advantage plan and wives by her spouse on a supplement and vice versa. It's okay to individualize your insurance.
Okay. Yeah, that's kind of what I was going to touch on next was, if you have, let's say you're transitioning into Medicare, your current doctors and specialists, will they still, there's a way for them to still see those people under those plans, or, do you need a referral? Do you need a, there's so many questions, right?
Right. With original Medicare and a supplement, they can see any doctor or hospital as stated. With a Medicare Advantage plans, that's why it's awesome when they use me, because this past year, there's 611 Medicare Advantage plan choices. And your doctors and specialists don't have to accept that Advantage plan. So when you meet with an independent professional, if they're doing their job, they'll ensure that your doctors and hospitals are in network. And additionally, that your medications will be most cost effective. And that's how you narrow down among the 611 plans in the state of Florida and the various states.
So I know you touched on this briefly. I know you mentioned it. I heard you say it. But if you travel out of the state or you spend your winters away from somewhere other than Florida, will that current coverage follow them, or will you be paying out of network rates?
The majority of the time, I encourage my snowbirds to sign with Original Medicare and a supplement. However, you can do an Advantage plan, but they're regionally based, which means the majority of the time you have to call ahead, search, see what provider takes it. And there's a great chance that you'll be out of network. And when you're out of network, you're not paying a copay usually. You're paying a very high percentage of 40 to 50% of the actual cost. So that's what can be very costly.
Okay. When you have that initial enrollment period, I know there's a 7-month window, right? Mm-hmm. 3 months before your 65th birthday, birth month, and 3 months after, right?
Correct. You want a job?
Yeah, sure. But what happens if you miss it?
If you miss it for Part B, then if you do not have credible coverage and the marketplace is not credible coverage, only your employee group health plan can be viewed as credible coverage, then you're going to be looking at a 10% penalty, and that formula can be a little bit difficult to explain. Whereas the Part D, D for dog, you can have a lifetime penalty if you do not enroll upon initial eligibility. And the easiest way to say the formula is 1% of the average cost. The average cost this year is 39 cents per month. So but it's in perpetuity. So what does that mean? Let's just round up to 40 cents. If, for example, you did not sign up for a drug plan for 60 months, 5 years, well, we know 60 times 4 is 24. So if you did join a drug plan at the age of 70, now you would inherit a $24 a month penalty on top of your premium for the rest of your life. So that's why it's very important to work with someone who knows what they're doing, because these rules can be very, very confusing.
I was going to say that is so, tedious. It's like, I'm sure it can be so confusing. But this is why, we have Brian here. If you have questions, please don't hesitate to reach out. We talk a lot about, at Evolution, we talk a lot about Roth conversions and tax bracket management. But you can't always do that in a vacuum because of IRMA. Would you break down why a client's tax return is the first thing that you might want to look at or consider?
Well, speaking about IRMA, it's not the hurricane that hit here in 2018. It's not my great aunt. It stands for Income Related Monthly Adjustment Amount. And In short, I call it success tax. If you make more money than the government thinks you should make, then they charge you, tax you accordingly. And it's always a 2-year look back. So in 2026, they're looking back at 2024's tax return. So especially when you get into required minimum distributions, and it's always they're looking at line 11 of your tax return. I'm not an expert on this, so that's why I usually default to a company who does have CPAs or who really understand that, so they can make sure that you're not paying for years and years and years paying more than you should be paying, because there can be some creative financing that is legal on strategies that you have no idea about. But you are allowed to appeal, and most people don't understand that. If you get for example, if you were to inherit a lot of money or make a ton of money one year, or if you were working in 2024 and now you're retired, let's just say, for example, just something ridiculous, that you were making $1 million. Well, you're not making $1 million now. However, the IRS and Social Security, they are looking at your tax returns, and there's a 2-year lag time, which means if you don't say anything within the first 60 days and you don't appeal, well, it's going to take their records 2 years to catch up, which means you're overpaying for 2 years and you're not going to get that money back. So it's very essential from day one to meet with someone who knows exactly what they're doing. If not, you're going to waste a lot of money.
And I think a good example of, I like this one. Adam uses this sometimes. You're both let's say you and your neighbor, you're both paying for Medicare, right? And one of you is paying IRMA charges. Your neighbor isn't going to get a helicopter, and you're still going to get the ambulance. You're both going to get the ambulance. Nobody's getting, anything better, because you're paying more. Is that kind of
correct?
Correct. Yeah.
If you go with original Medicare, you're going to pay that's the only thing. Your Medicare Part B premium and Part D is based off of your income, which most people do not have to worry about that. They pay the minimum $202.90. However, if you are in the IRMA boat, then that's something you do have to, that's the difference. That's the only difference, is the amount you pay. Your services, if you go with a supplement, it's identical coverage. If you go with an Advantage plan, it's identical coverage. It's just that step one, the very beginning step, is where some people have to pay more up front.
Right. And so if you're single, it's $109,000, right? You go a penny
Right.
over that. Or if you're married, filing jointly, $218,000. When I say numbers like that, I think a lot of people are like, oh, I'm not going to be making 109 or 218, but it's easier than you think. You sell a property, you sell a stock, you have an RMD, you have a Roth conversion. If you're not careful, those are all things that can take you over, that income level.
And what we're seeing now is people are working later and later in life. Before, a lot of people would retire at the age of 62 or younger. And now when I'm meeting with a lot of clients who are turning 65, they're still working, or still, because they want to hold off on their Social Security until they're 67, their full retirement age, with people born 1960 and beyond. So what's happening now is you're having a ton of people who they're working through, and it could affect, and they don't have any idea on how to solve it, because at 65 years of age, back in 2024, they were making a big salary. And if they don't know what to do, they will be wasting a lot of money.
I'm so glad. I'm so glad you're on this podcast, Brian. I think it's so important that people consider this as one of, like we talked about in the beginning, it's such a crucial thing for your financial. It's a financial variable, if you will, and I think some people forget about that. I want to talk a little bit about like the risk management and Advantage versus supplement. Also, let's talk about the $0 premium plans we see on TV. In a goal-based retirement, how do you frame the choice? How do you know who to pick, right?
Well, they're saying now that 50% of Americans go with original Medicare and 50% go with a supplement, 50% due to the Advantage plan. The Advantage plan wasn't, Medicare and supplements have been offered since 1965, whereas the Advantage plans came into play in the early 2000s. It's just like I said from the beginning, you need to base your decision off of those factors, and those factors, no two people are alike. Now, when I meet with clients, I'm about 70% of my clients choose a supplement, whereas the 30 choose the Advantage plan, because I educate a little bit deeper. Why do I mean that? Because there's a lot of rules that people do not understand. At the age of 65, when you're in Medicare, this is paramount. This is one of the most important things that's not taught out there. No supplement company. There's not a supplement company among the 30 in Florida that are allowed to ask you any underwriting questions to obtain that supplement. However, so they'll allow you, though, to take a free trial. It's called your trial right, trial look. Go into a Medicare Advantage plan for up to 12 months. Then, however, if you do not switch back to original Medicare and that supplement, the rest of your life, if you ever wanted to, you would have to qualify through medical underwriting with all 30 supplement companies. Wow. So that's a big factor, because most of us look short term. Hey, I'm healthy right now. Well, that's nice, but that's why, again, the health history. If you had a heart murmur when you were 13 years of age, they look at all of this stuff. These insurance companies, I wasn't a fan growing up of insurance company, and when I got in this business, I just teach people the rules of the game so they know how to play. So you have to take all these factors, because if there were no rules and you could do what you want, it wouldn't be a 50-50 split. It would be 100% of Americans on Advantage plans. And then when they needed more comprehensive insurance due to an ailment, upcoming surgery, or cancer, then they would all switch over to a supplement because it's more comprehensive coverage. When they were done doing that, they would switch back over to an Advantage plan. But that's not the way the rules are set, and you can't do that. So you really have to look long-term right from the beginning, because the decision that you do make can and will affect you the rest of your life.
I want to ask you, because everything you're saying, I'm listening, and I know I'm not near Medicare age, but for people that are, as simple as possible, can I say that Medigap or Medicare supplement, you're transferring the risk to the insurance company. And with Medicare Advantage, it's more of a pay-as-you-go that works okay when you're healthy, but your max out of pocket, can be...
Exactly.
Yeah?
That's an excellent scenario. For example, if you're breathing, and you sign up for your Medicare card, which I call step 1, you're going to pay a minimum of $202.90 a month unless you're limited income subsidy, which the government will categorize you that, or you're on Medicaid. So everyone's paying that. That's a wash. You can look at it and say, hey, you know what? I want my 20, because Medicare is 20% coverage. So let's focus on Medicare supplement right now. I'll pay for the additional 20%, like Aflac, a supplement. They're going to charge you for that 20%. Let's just use $200 as an easy figure. And we know 200 times 12 is $2,400. So people who are conservative who say, you know what, I'm going to pay $2,400. And if I don't do anything that year, the insurance company keeps that money. So that's how the supplements work. Now, the insurance carrier loves people who are healthy. Why? Because they get to keep your money, your $200 a month. But if all heck broke loose and it was humanly possible to have a stroke, a heart attack, and a kidney transplant in the same year, you're still paying that $200 a month, and that's it. So you don't like a supplement when you're healthy. However, when you're not healthy, it's
everything.
It's everything. Contrastly, when you look at the Advantage plan, well, when you're healthy, well, guess what? You love it because you get your silver sneakers. You get you when you're on the golf course, you get to tell your buddies, "Oh, I pay nothing. I pay nothing. It's all free. It's free. It's free." However, when stuff hits the fan, excuse my language, Well, then guess what? Your maximum out of pockets on these plans of the 300 plus PPOs in the state of Florida, which I would, if you're going to go into an Advantage plan, I would advise to eliminate referrals and to be seen by more doctors and hospitals. Your maximum out of pockets now in Florida range from $4,600 to $8,900 in network. They range from $9,350 to $15,000 out in network. So I always tell people insurance is gambling. If you're conservative, you put the $2,400, $3,000. No, that's the worst I'm going to do this year. Or you say, you know what? I'm going to gamble. And if you gamble, yes, some years you'll win, some years you'll lose. It takes one bad year to have 3 to 4 years worth of supplement payments. However, if you do not take that supplement upon initial eligibility, you might not ever be able to get it. So that's why you have to look long term.
All right. Well, I guess what I'm curious about is Medicare something at 65? Is it a set it and forget it, or is this something that you need to review annually?
You need to review it annually. Medicare supplements, you never have to reapply for Medicare. No one does. So with the supplement, you can review it annually, but there's states are different with their supplements, meaning they're issue age rated. What does that mean? Issue age rated means if you get a supplement at the age of 65, your rate does not increase as you age. And that's one of the best 5 states to be in. My mom and dad, they were in a state called attained age, and 40 states are like that, including most of the northern states. That means every year they get a birthday, the insurance company sends them a present, and it's a rate increase. So the reason why you better do all the research and have an independent person research it with who represents the majority of all the companies is you can look at rate history. Do you want to go with the cheapest company the first year, and next year they raise it 30%? You make sure you go with a company that's slow and steady with the supplement. On the Advantage plan, you need to make sure who covers my doctors, who takes my specialist, who handles my medications the cheapest. For example, and then the Part D needs to be reviewed every single year. I worked this year with some clients who I saved them over $1,000 just by switching them to a different plan. So you got to really, if you like wasting money, don't do a review. In essence, that's it in a nutshell.
Yeah. Well, Brian, thank you so much. Anything else that you want to touch on that maybe we didn't go over today?
I just did, but I'm getting older. I'm 56, and my head just went like Swiss cheese there. I did have something to that, but I mean, you guys have been wonderful to work with. Your clients have been wonderful to work with. And, everyone just needs to be educated because our school system does not do a good, even as a former teacher and a former school principal, we do not do a good enough job in financial literacy with our youth and young adults and even our adults. So they learn the hard way. I tell people a little joke. I say, you know what, you remember how your credit score affected everything, like your car purchases and your house your whole life? Well, upon turning 65, I make a little joke that your medications are your new credit score.
Wow.
You do not want, if you can see if you see your medications and they're advertising commercials on TV, it means commercials are very expensive, and somebody has to pay for that, and it's going to be you. So hopefully you can stay healthy, and if at all humanly possible, not be on those prescriptions that you see on TV.
Thanks, Brian. And thank you for bringing an educator's heart, educator's perspective to our listeners, and for being just a huge key partner in our success here in our process at Evolution. We just love you.
Well, thank you for having me and giving me the opportunity to help educate
Absolutely.
people out
there. If you want to see how Brian if you want to see how Medicare choices are impacting your tax and income plan, you can reach out to us, 239-771-8696, evolutionretirementservice.com, and we can get you connected with Brian over at Senior Healthcare Professionals. again, like, subscribe. If you have questions, send them over to me, Lauren at evoretire.com. We are Evolution Retirement Services and Evolution Wealth Management. Thank you so much for joining us today.
Thank you.
Investment advisory services are offered through Evolution Wealth Management, Inc., an investment advisor registered with the United States Securities and Exchange Commission, CRD number 307644. Registration does not imply any level of skill or training. You can obtain a copy of Evolution Wealth Management's firm brochure, Form ADV Part 2A, and Client Relationship Summary, Form ADV Part 3, free of charge by visiting https://advisorinfo.sec.gov/firm/summary/307644. Evolution Wealth Management offers investment advisory services only where it is appropriately registered or exempt from registration, and only after clients have entered into an investment advisory agreement confirming the terms of engagement and has been provided a copy of the firm's ADV Part 2A.